Welcome to Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. When a loved one is diagnosed with Alzheimer's disease, it can feel devastating. This disease will be life-changing for your loved one and likely for you. The senior in your life will require a special amount of support, love, and devotion, so you can make sure she is safe and cared for. Alzheimer's is a slowly progressing neurological disorder, which means that your loved one will become increasingly dependent as time goes on. While there is no cure for the disease, there are ways to slow the progression. Everyone experiences Alzheimer's differently, but there are 7 stages that you can expect your loved one to go through after a diagnosis. It's important to know what to expect as you face this new diagnosis. That way, you can be better prepared to be there for your loved one and hopefully won't be taken by any painful surprises. Alzheimer's is not a normal part of aging, but it does affect a large number of seniors every year. It's the most common form of dementia. The disease is the 6th leading cause of death in the United States, affecting 1 in 10 Americans over the age of 65. Far too many cases go undiagnosed, and these statistics can be hard to come to terms with. If you sense your loved one might have Alzheimer's but aren't sure, it's important to understand how common the disease is and what signs and symptoms to look out for. Because Alzheimer's is a cognitive disease, it impacts memory, thinking, and language. It can also impact movement, problem solving, and even personality. Eventually, daily tasks will be nearly impossible to accomplish. But with the right treatment, it can be possible to delay worsening symptoms. Before we get into the stages, it's important to remember that everyone is different. Alzheimer's might not look the same for your parent as it did for your grandparent, for instance. Still, these stages give us a pretty good idea of what we can expect moving forward, before and after a diagnosis. The period before a diagnosis is known as preclinical Alzheimer's disease. This stage is considered a normal part of aging because symptoms are too subtle to isolate. A person might be in the preclinical stage for years before their disease develops. Over time, scientists hope to develop advanced imaging technology that will indicate when a person is in this stage. That way, they can get an early start preparing for what's next. Slowly, a person will start to experience very mild forgetfulness. This is considered the 2nd stage of the disease. It's common at this stage for a person to forget a word or misplace something. Your loved one's daily life will not yet be affected by the disease. They can still live independently. Often, family, friends, and even doctors won't notice that anything is wrong. Your loved one might confuse names or places, take longer than usual to express herself, and have a hard time with complicated tasks like paying the bills. Again, these symptoms are usually subtle, and they can be mistaken for normal aging. If you notice that your loved one is experiencing forgetfulness, you can have her engage in mental activities, exercise, and eat healthy. While the progression of the disease is inevitable, activities like these will help your parent to have a stronger cognitive performance. The 3rd stage of Alzheimer's is known as the mild dementia stage. It can go on for as long as 7 years, and the symptoms will usually appear slowly. During this time, memory problems might become severe enough for doctors and family members to take notice. A person in the mild dementia stage might have trouble completing tasks or solving problems. If they had been planning an event, for instance, they might struggle greatly with that task and become overwhelmed or exhausted. During this stage, they could also start sleeping more frequently during the day and staying up longer at night. They might get lost driving or walking along familiar routes, or struggle to remember new information. In this stage, their personality might start to slowly change. You might notice that your loved one is withdrawn or irritable during socially challenging situations like parties, group events, or meetings. She might become overwhelmed by a lengthy visit with grandchildren, for instance, or following a meeting with a financial advisor. Continue to work with your parent on mental exercises and making sure they are eating right and exercising. It is also recommended that your parent engage in counseling, especially if he or she is in denial or experiencing anxiety. The fourth stage of Alzheimer's usually lasts 2 years. It's known as moderate dementia due to Alzheimer's disease. This is the stage when most people receive an official diagnosis. You might notice that your mother or father is struggling to complete everyday tasks, like getting dressed or changing their clothes. They might not know the proper clothes to wear for specific events, such as weddings or funerals. Occasionally, they could lose control of their bladder. Memory loss will be even greater during this time. They might start to forget important details about themselves, such as their address or their first job. They could make up stories in an attempt to fill disorienting gaps in their memory. At this stage, they might also begin to wander. Oftentimes, especially when away from home, a person with Alzheimer's wanders in an attempt to find something familiar. At this stage, it's important not to leave your loved one alone. They could even wander from their own home if it momentarily seems strange or unsafe to them. Still, home is often the best place for a person with Alzheimer's to be, because it's where they will feel safest most of the time. The fourth stage of Alzheimer's disease is also when most people experience major changes in their personality. This can be extremely difficult to witness. You might feel that you're losing part of your mom, dad, or grandparent, or find yourself offended or hurt when they lash out. Remember that these mood swings are your parent's disease, not your parent. Try to remain calm, patient, and gentle. If you are angry or frustrated with your parent, this will only exacerbate the situation. These personality changes can be severe. They could become irritable and agitated and even lash out in anger. You might notice they are hearing or seeing things that simply are not there. Again, these personality changes are heartbreaking for any family to experience. It will take an enormous amount of patience and love to get through. It's essential to keep in mind that these mood swings are simply not personal. They are the product of a cruel disease. The fifth stage is referred to as severe dementia due to Alzheimer's. At this stage, your loved one will need a significant amount of support. It lasts about 1 to 1.5 years. Without care, your parent might feel unsafe, insecure, and increasingly angry. During this time, you might notice that your mother or father is increasingly paranoid. They might become convinced that a caregiver is stealing, that their children are lying to them, or that their spouse is having an affair. With the help of an experienced caregiver who provides your parent with a steady routine and daily mental exercises, this paranoia can be calmed. They might not remember what the weather is outside, if their granddaughter just got married, or what their phone number is. Often, they'll struggle with mental exercises like counting backwards. They will recognize names and faces of those close to them, but might struggle to speak with them in ways that make sense. They will require help with everyday care, such as bathing, eating, and using the bathroom. In some cases, your mother or father might have a hard time walking, sitting, or even holding up their head without support. They could start struggling with swallowing and will eventually lose their ability to swallow altogether. Memory care and professional home care are the most common types of care for a person in this stage of the disease. If you are able to keep your parent at home with constant care, this is usually the best choice because they will feel safer in familiar surroundings. When a person with Alzheimer's finds themselves in a strange place, their cognitive abilities can decline at even a faster rate. For more on choosing the right type of care for your loved one, you can listen to our episode on choosing the right type of care. Stage 6 is moderately severe Alzheimer's. This typically lasts around 2 or 3 years, and you will notice that your parent is struggling very severely. There are 5 main characteristics for someone in this stage. They will no longer be able to dress on their own. They will need help brushing their teeth and keeping up with hygiene. They will need help using the bathroom and with toilet cleanliness. They will struggle to count backwards from 10, and they might start stuttering or struggling to speak. At this stage, your parent might also confuse family members and forget significant life events. This can be heartbreaking to experience for any family, but it's knowing what to expect that can help prepare you. Ensuring that your parent has 24-hour care is essential, especially because they might leave the house at night and get lost or lose their balance when attempting to dress or bathe themselves. They will also need help to eat. And the seventh and final stage of the disease is severe Alzheimer's. During this stage, your loved one will feel completely lost. They might become fully immobile and lose their ability to speak. 40% of people in the seventh stage of Alzheimer's form hardening of muscles, tissues, and contractures, so they may feel constantly uncomfortable. This can result in behavior like thumb sucking in order to feel more secure. This stage is especially difficult for family members because the reality is that you may no longer recognize your parent and feel frustrated that you can't do more to help. It hurts to see our loved ones in pain and unable to move or speak. You can provide support for your parent by being present with them, speaking gently to them, and making sure they are not alone. Even though your parent cannot engage in conversation, she still benefits greatly from your companionship. If your loved one has been diagnosed with Alzheimer's disease, make sure that you are getting all the help you need too. Find local support groups for families facing the disease and turn to friends and family when you need them. The better you care for yourself, the better you can care for your loved one. We want to thank you for joining us here at All Home Care Matters. All Home Care Matters is here for you and to help families as they navigate long-term care issues. Please visit us at allhomecarematters.com. There's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. If you know someone who could benefit from this episode, please share it with them. And remember, you can listen to the show on any of your favorite podcast streaming platforms and watch the show on our YouTube channel. And make sure to hit that subscribe button so you'll never miss an episode. Please join us next time as we talk about tips for dealing with arthritis. Thank you so much.
Thank you for joining us today. We look forward to you joining us again on another episode of Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.